So welcome everyone to the Pennsylvania DHS Alternate EVV Town Hall. It is Friday, May 27th. So again, an early happy Memorial Day weekend to everyone. Just a couple of notes to talk about during this live event. This is going to be an overview of the alternate EVV process, including the PADHS EVV personal care services and the home health care services programs. This presentation is only related to alternate EVV agencies and vendors, and agencies who are intending to use the DHS EVV system need not attend. So again, if you're an alternate EVV provider or an alternate EVV vendor, this is focused towards you. If you're going to be using the free DHS EVV system, you need not attend. A couple of notes to take notice of during the live event. All participants are going to be automatically muted. If you do have questions throughout the presentation, please post those questions using the Q&A feature in the chat. If your question is not addressed during the call, Sandata and DHS will review questions after the meeting and provide needed responses. So again, we will do our best to try to respond to most questions during the meeting. However, if it's not addressed during the meeting, we will be looking at questions post-meeting. Also, one of the other things that we ask you to do is when you're posting questions, because if we move past a slide and it's specific to a certain slide, we ask that you put that slide number associated to your question in your question, please. So topics for today, we're first going to start off with some frequently asked questions from the previous town hall that we had in April. Then we're going to discuss a little bit about the alternate EVV timeline and milestone dates, new providers to alt EVV in the PAEV program, as well as vendor certification process. And then we're going to discuss the alternate EVV specifications in JSON files. Again, how to understand the specifications, how to understand the client overview in the JSON file, the employee overview with the JSON file, and the visit file overview with the JSON file. And then of course, we'll talk about the service codes and modifiers. And then we'll wrap everything up with the alternate EVV common issues and a short question and answer period, providing the time is allotted. Okay, so we're gonna get started with the frequently asked questions. So as a note, this town hall is being recorded. Once the session is over with, the town hall recording and the presentation will be posted to the Pennsylvania EVV website, and you can find that at the EVV public meetings page on the PADHS EVV web page. Can you clarify the different call types, mobile, telephony, FEV, and manual? So mobile is the logging of the visit with a mobile device, such as a cell phone or a tablet. Telephony is logging the visits via a phone call. And then FVV is fixed visit verification and refers to the fixed device in a client's home, which is used to record that visit. And then manual refers to a visit entered manually and not using one of the above mentioned call types. Again, anything that's outside of mobile telephony or FVV. For certification, for those vendors that are in the process of recertification and certification, what is the expected turnaround time for recertification? The turnaround time is dependent on the vendor and typically, can vary between 2 to 6 weeks and is dependent on the vendor's ability to pass the testing checklist. And again, your vendor is going to be testing in a testing environment, and if they want to take a little bit longer, please all means do so. But again, the moment that you pass the testing checklist, you can move on into the certification phase. There are some instances between the current spec and the new spec where the order of the segments are switched. So one of the things that we'll discuss again today is that, again, having the order match what is in the current spec as opposed to the new spec is not going to lead to a rejection. The system does not care about the order. Will existing providers already using or doing EVV receive new credentials to replace their original production credentials? And existing providers currently providing EVV services and have an EVV account with the DHS aggregator will not need new credentials. They will be using the same ones and they will not need new login credentials. And then the last question from, again, these are previously asked questions that were frequent questions. Do all EVV vendors have to test for each agency account to pass certification? While that was true at the very beginning of the program 3 years ago, no, that is not true. The vendor only needs to pass certification one time by testing successfully with one agency, and then all of their agencies that they work with are successful as well too, or successfully passed. Okay, I'm going to stop there. Any questions before I move on to the process from Mike, are you with me? Okay.
Yes. The one question we got so far is, will a copy of today's presentation be made available?
Correct, yes. And as we mentioned at the very beginning, the presentation will be posted along with the recording to the PA EVV website on the public meeting section. So again, when that will be posted, please monitor that site to make sure that when it's posted, you can access it.
And we had one other question on slide 4. How frequently would vendors need to recertify with SANdata?
This is one time at this point right now. Again, that is something that is a conversation that may come up in the future with Pennsylvania, but at this point right now, you only need to certify for home health care and PCS again between now and August 10th. Okay. All right, so good questions. Thank you very much. And we'll move on to the EVV process. So again, just a little bit of a program timeline we added in here. So currently, if you look at the current timeline, vendor certification and or recertification is currently going on. And home health care agencies new to EVV can register online. And again, this is just the timeline, so we'll go into more detail for these later on. As of April 26th, vendors who passed the certification may begin sending new required data fields as described in the new EVV tech specs for PCS. So if your vendor passes the tech specs and there's new data fields in there, they can start passing those currently, not the service codes for home health care, but all the data fields. Then beginning July 18th, SANdata will begin to send credentials to new home health care agencies. So if you are a home health care agency only and you do not have credentials, you will not be able to get those until beginning of July 18th period of time. So again, if you sign up and you enroll online, don't worry, we will get those credentials to you. However, we're not going to start doing that until July 18th. Then on August 10th, this is the date that everyone needs to pay attention to. All vendors must have completed recertification by August 10th. Home health care services codes can be sent to the aggregator and should be sent starting August 10th. And then the new payer program codes in the specifications need to be sent to the PADHS aggregator. Let me go through it again. August 10th, all vendors must have completed recertification. Home health care service codes can be sent to the PADHS aggregator, and the new payer program codes need to be sent to the PADHS aggregator. And again, we'll talk about that last one as we go through the presentation. And then on January 1st, 2023, that's when healthcare claim denials will begin. And again, we want to make this as a big footnote here, that failure to retest and certify will result in file rejections and PCS claims to deny after the August 10th, 2022 timeline. So please don't hesitate. Make sure that you're working with your vendors to make sure that they have passed the recertification by that August 10th timeline. Okay, so alternate EVV vendor certification dates, important dates to know. And I keep saying August, apologies. On April 8th, 2022, the DHS Alt EVV Quick Reference Guide recertification was published on the PADHS Alternate EVV webpage. Then on April 26th, current PCS vendors received an email to start the recertification process. And as we mentioned before, August 10th, you're going to hear it throughout this whole presentation. August 10th is the date that you really need to pay attention to, that Alt EVV vendors must adopt all system changes, complete testing and recertification. And as we mentioned before, failure to retest and recertify will result in file rejections and PCS claims to deny after the August 10th, 2022 date. So, and new vendors, if you are not an existing PCS vendor and you're new to the Pennsylvania program, new vendors not previously certified in the PCS program, again, on April 8th, the quick reference guide, which is a little bit different. So you'll note that there's two different reference guides. There's new certification and then there's recertification. For those that are new, you'll look at the new vendor certification process, and that was published on the PADHS Alt EVV webpage on April 8th. And again, same for these vendors on August 10th. New vendors must adopt system changes, complete the testing and certification, because at that date, that is when the providers are expected to begin submitting the home healthcare services Alt EVV files to the DHS EVV aggregator. Stop right there. Any questions? Because there's some very important dates. All right. Do we have any questions, Mike?
Ones that we can follow up on. Nothing that I think we can.
Okay.
Yep,
Now we can
none
move on.
related to the date.
Okay. And just as a note for those, again, if we see a question that's popular, we'll try to respond to it here as well too. If there's questions that are specific to your vendor or your agency, we'll probably answer those a little bit offline for you. So anything that gets too specific, we will follow up with you. So program code updates. Again, we'll talk a little bit more about this when we get to slide 16, I believe it is that the program code and service code updates are based on data service. And you'll see that there's new program codes. This is not the service code, but this is the program code. And then the service code updates are based on data service. So please utilize the legacy PADHS alternate EVV technical specifications and service codes for visits submitted to the PADHS EVV aggregator prior to August 10th. So there were some previous technical specifications that were posted prior to August 10th. Those were for PCS. If you're submitting PCS, you should still be using those in terms of service codes and program codes. The update to the codes and the service codes, for example, T1019, for all visits submitted on or after August 10th, should align to the PADHS alternate EVV technical specifications, which are posted on the Pennsylvania website. Again, updates to the program or the updated program and service codes are listed on the website currently at PADHS alternate EVV technical specifications. Okay, so moving on. New providers. If you're a new provider to the Pennsylvania and you're new provider to Alt EVV and PADHS, some important notes for you. If you're new, there is a registration link that is on the Pennsylvania website at PADHS Home Health Alternate EVV new provider registration form to initiate the process for you to get credentials. Okay, a link on that for that registration will open up a questionnaire for you to fill out. That questionnaire will ask you to fill out in completion questions that we need to help provide you credentials. Questions like your vendor, and who your vendor is, and what your agency is. If you have multiple locations, and if you have multiple locations and multiple provider ID numbers, you will have to register multiple times. So again, bear with us on that. But if you have multiple locations and you use multiple Medicaid provider ID numbers, you will need to register multiple times. Once you register, you will get an email, and that email will respond back to you and let you know if your vendor is recertified, and then they will issue your credentials within 5 business days. And again, we're not going to start doing that until July 18th. So again, this 5 days is 5 days from July 18th. So I want to avoid some confusion at that point right there. Your vendor is currently testing to be recertified. So if your vendor is still testing and is recertified, is still going through the process of recertification, we'll let you know about that too. And then C, if your vendor is new to Pennsylvania and they need to begin the testing process, we'll let you know if your vendor needs to start that process and what the next steps are with that. So again, once you fill this registration form, you will be informed of whether or not your vendor is completed certification, is still in certification, or needs to begin the certification process. And I'll stop right there to see if there's any questions.
Yeah, so we did have a question regarding a provider that's currently using SANDATA EVV, and they were just verifying that they would not need to be recertified.
So if they're using the DHS SANDATA EVV, or is this an alternate EVV user? So SANDATA EVV, this call is actually, if you're using the SANDATA EVV system, then this call actually is not something that you need to attend. But if you're using an alt EVV vendor, then this would be a call that you probably need to listen in on. So if we can get some clarification on that call, Michael, that would be helpful. Or on that question, excuse me.
They specified SANDATA EVV. So.
Yes, yeah, and so again, the vendors are the ones who get certified, not the agencies. So if you're an agency, you're not getting certified, your vendor is. And if you're using the SANDATA EVV, then of course that's done automatically by using the SANDATA EVV.
And then just another, just to reiterate that, we had a question on whether there would be a PDF or
right.
a PowerPoint of this uploaded to the
right.
or sent
yeah.
out.
Yeah.
But it will be
for those
uploaded.
of you that didn't, yeah, for those of you that's fine, yes. And for those of you that didn't make the beginning of the call, this call is being recorded and the PDF will be posted on the PADHS website. All right, so moving on. So alternate EVV vendor recertification process. Most vendors that were part of the PCS program have already received this email, but we'll go through this just real briefly. Again, they were sent an email on August 26th with their testing credentials from the PA alt EVV support team. The recertification email contains recertification testing and instructions, as well as their credentials and a checklist for them to fill out to complete and send back to SANDATA or to the PA alt EVV support team. The PA alt EVV support team will email the vendor indicating the vendor checklist has passed or needs additional work, provide any feedback or information that they need to know how to pass that checklist, and send it back to the vendor. And the vendor will have as many attempts as they need to pass the checklist. And if you have any questions, again, about this, there's a link that'll be in the PDF that's provided after the meeting on the website. You can go to that, go to the PDF and see all the links that are in here to get to the appropriate page on the PADHS website for the quick reference guides. So again, there's 2 different quick reference guides, again, one for the recertification process and then one for the new certification. So vendors who are not certified and were not certified during the PCS EVV program can review the PADHS alt EVV technical specifications and the DHS alt EVV quick reference guide on the Pennsylvania website. Once a new provider to the PADHS program completes the PADHS Home Health Alternate EVV New Provider Registration Form, the new vendor will be contacted by PA Alt EVV support team. So this second bullet is a very important bullet for those that are new vendors. If you're a new vendor to the Pennsylvania program and you do not have a client in Pennsylvania, you need to have a client register first on the registration website to begin your testing process. Again, if you are a new vendor to Pennsylvania, you need your agency, client agency, to register on the registration site to begin the testing process. That's again only new vendors to Pennsylvania. So to follow up, PA Alt EVV support team will email testing credentials to the new vendor based on the information the provider submitted in their registration form. And then the vendor completes the testing until the submitted checklist is passed. And again, the PA Alt EVV support team will check that checklist to make sure that everything passes and send it back to you with any information that you need to help pass the testing checklist. Once you have passed, then we will inform the agency of your successful completion of the checklist. So a couple of quick pieces for the vendor certification. Again, these are things that we need to emphasize. Once the vendor has completed certification, again, vendor certification is required in the PADHS EVV program. Certified vendors in other states will require separate certification in the PADHS EVV program. Vendor certification, recertification is required to submit home health and PCS visits to the DHS EVV program. And again, notices will be sent through the DHS listserv and PA Alt EVV support team if the PADHS EVV timelines change. Until you hear otherwise, those times, as you've heard previously in this presentation, is currently August 10th, 2022 is the deadline to complete the recertification process. So, and then lastly, just a couple of clarifications again about the vendor certification. The testing and certification process is established for vendors to test their system's ability to communicate with the PADHS EVV aggregator. Successful certification does not guarantee successful delivery of EVV data in the production environment if the technical specifications are not followed. Once certification testing is complete, please make sure that you comply with all the requirements described in the PADHS alternate EVV technical specifications located on the third-party alternate EVV webpage. And again, just because you passed the certification doesn't mean that you're going to be able to successfully send your visit data if you're not following the technical specifications. So make sure you keep those handy so that you know that you're sending things appropriately based off of those technical specifications. So I'm going to stop right there before we go on. And any other questions, Michael?
Yeah, we did have a couple other. One question, do agencies need multiple SAN data accounts if they provide EVV services for multiple programs?
So this is kind of an interesting question. So if you're going directly to the aggregator, no, you'll have one account for one MPI. If you're submitting multiple promise IDs for claims, you're going to need multiple accounts. So depending on if you are using one MPI or a Medicaid provider ID number with promise or multiple Medicaid provider ID numbers in promise, that's going to be the determinant of whether or not you need 1, 2, or 3, or more accounts in that regard. So I hope that answers that question.
Next question, can new providers register for alternate EVV prior to July 18th? We understand credentials won't be available until then.
Yes, so the registration link is up and it has been available since April. You can go there and enroll now. That link is available to you right as we speak. And once you register, excuse me, I don't want to use the word enroll. Once you register, you will get that email immediately indicating that you've successfully registered and then what the next steps were. So yes, you may.
And we'll squeeze one more in here. Can agencies certify themselves as the vendor?
I think we'll need a little more information on that. If you are using your own homegrown system, then that would be a possibility. Probably need a little more information to be able to answer that completely. But if you are using a homegrown system, then I mean, yes, I would say that would be a yes. But again, we do need more information.
Hey, Paul, this is Clella. I'll just jump in here for a minute. You will need to go through the same certification process, complete the same checklists, work with our teams to make sure that you have that solution working alongside what is necessary for our aggregator. But at the same time, there's no reason that you can't complete those codings yourself and as an individual provider, as your own vendor.
Thank you, Chloe. And Mike, any more questions before we go over to the Alt-EV specifications conversation?
Yeah, I think we'll save those for later, though. It's
Okay.
a little more.
All right, perfect. All right, well, thank you, everyone. And I'm going to hand it over to Chloe, who's going to talk about the Alt-EV specifications and the JSON files.
Thank you so much, Paul. So welcome to the town hall. We're now looking at some of those alternate EVV specification and JSON pieces. We have gone through this a few times in our town halls, and we'll, again, run through these pretty quickly, but we'll answer as many questions as we possibly can during the presentation. So understanding the specifications, they are posted, as we've said a couple of times now, for the program on the PADHS alternate EVV webpage. It does encompass all payers and programs. We've now combined those into a single technical specification that allows for all of them to be aligned. There is a link that is provided here. This whole presentation will, of course, be available to everyone, and so they should be able to use those links as needed. The PADHS alternate EVV technical specifications, have a lot of really rich information in them. So we do want to make sure that those are the compass that you use as you're navigating. Paul, go ahead and move to the next slide, please. So in that, we've got 3 different transmissions that we're looking to have alternate EVV vendors supply. One is the client overview. It does have 4 segments as part of that client record. We've got the client general, client pair, client address. All of these 3 segments are required on each client record that comes through. The client phone is not required by the system, but is required by PADHS EVV program if it's available. All of these segments will comprise that client record. They do have various information that we would be expecting to give: client's name, address, the Medicaid ID. As part of that, we are going to use some identifiers for that matching logic. One is going to be our provider ID value. That provider ID value that gets sent through should be aligned to the types of services that are being provided. So in our appendix 9.1.1 of that specification, HCPCS procedure codes, you're going to find whether or not it specifies that an NPI or a Medicaid ID, the Mary PI, is going to be delivered as part of that provider ID value. The client identifier is the 10-digit Medicaid ID. Those values are used for us to be able to know whether or not we are updating a record or we are going to be creating a new record and make sure that we're in the correct provider account. Client validation is going to be on that provider ID, on that client identifier's length, so 10 digits, and then that client payer segment that's provided and the other required segments. Let's go ahead and move on to the next slide. So this is a look at our client JSON specification and the elements that are required. So it is a RESTful API. We are expecting a JSON transmission. These are some examples of what they look like. So as you look on the right-hand side, you'll see the JSON equivalent of what those specifications are that we are providing. We've got that provider section that has those provider elements for provider qualifier and provider ID. Then we have that client general segment. Again, that's going to have all of those regular pieces of information that we're looking for. And then we've got that client payer information that's a child segment. You'll see that that's indented. And then it's got some information that we're passing through there. Same thing for client address and client phone. What this means when we talk about a client or a child segment, that means that it can be repeated. If you need to send multiple client payer information, multiple addresses, multiple phones, those segments can be repeated within this JSON transmission for a single client. Let's go ahead and move on to the next page. The client payer child segment, we did want to spend a couple of minutes here to look at this, although it has been required for service authorization from the provider. And there are 5 required elements to that segment: the payer ID, the payer program, and the service. All of these are noted in Appendix 9.1 and 9.1.1. The client status, it'll tell us whether or not that client is active. And then there are some new fields that we're looking for: modifier 1, modifier 2, modifier 3, and modifier 4, as appropriate for the services that are being authorized for that client. Again, not a new segment, but those new fields of modifier 1, modifier 2, modifier 3, and modifier 4 are what we want to highlight here, since it will be applicable to some of those service codes. Great, let's go ahead and move on. The provider identification qualifier. So we talked a little bit about the fact that we will be sending through that provider segment with that information based on what services are being provided. In Appendix 9.1.1, there are listings on those payer program service combinations that explain whether an MPI or NPI, so Mary provider ID or Medicaid provider ID or the national provider ID is appropriate to send through with that service. And you will be changing that qualifier to match, the Medicaid ID or NPI would be the string, again, based on that appendix. Thank you very much. Go ahead, move on. Employee overview. So we do have one required segment for employee. It is an employee general information. The identifiers that are used for that matching logic, again, that provider ID value, again, it should be representative of the services that are provided. The employee identifier, and we'll talk a little bit more about the employee identifier formats. And then that validation check would be that the employee identifier does pass that length check that's appropriate for that field, and that the employee identifier matches an existing record. If there is no match, we will be inserting a new employee record. If there is a match, we'll just be updating the existing record. Let's go ahead and move on. And in the employee identifier, we do want to look at a couple of different options. Preferred is going to be that PADHS unique registry ID if that is required as part of, or applicable if it's part of your program. So that format is required for the PA, if the employee does in fact have the PADHS unique registry ID. It's applicable to the OLTL participant model, directed model, or if you are instructed to have that particular unique registry ID. Second, and probably more common, is going to be the vendor-specific employee identifier value. There is an appendix 9.4 that has those vendor prefix codes, and this format will be the 2-character vendor prefix code followed by the 7 additional characters that would make up that employee identifier. So whatever the vendor systems identifier is for that caregiver or employee, we do need to make sure that those are unique. So that should be a unique value for each employee within the provider agency. The last 5 digits of the Social Security number formatted as 4 zeros followed by the last 5 of the Social Security number is discouraged. It does have a high incidence of duplicate caregivers, which means that those employees either get rejected or you're updating the same employee record, because remember, this is one of those identifiers that we use to match the employee record. So the same format that you do use for this employee identifier must be used in our employee general and visit general segments. All right, I'm going to go ahead and take a break here, and we're going to go ahead and take some questions on caregivers and employee data transmissions. Go ahead, Michael.
We did have one question regarding vendor certification and submission of the data. So vendors need to be certified by 810, but are agencies required to submit EVV data on 810 as well, or does the actual submission process start on 1/1/23?
So the expectation is that you're submitting the home health care services codes beginning August 10th. So while your vendor needs to be recertified by that time. So in order for you to be able to start the soft launch. So there's a soft launch period that starts on August 10th and it goes till the end of the year.
And then we had another one about the IDs. Just to clarify, if we have 2 Promise IDs, will we need to have 2 SANdata accounts?
Yes, you will need to register on the online registration form multiple times. So if you have 5 different Medicaid provider IDs with Promise that you need to use, you will need to submit and register 5 different times for each one of those. Correct.
Okay. And it's one other one. Also, will SANdata only be handling the EVV for Promise? Who will handle the ones for CHC and OMAP?
So repeat that, please.
Will SANdata only be handling the EVV for Promise? Who will handle the ones for CHC and OMAP?
So just not
The
to
OMAP being
overcomplicate. Yeah, go ahead,
referenced
Janelle.
here,
Yes.
sorry,
yes.
the OMAP
Yep.
being referenced here is pertaining to the physical health choices. They're asking if the free DHS EVV system cannot send data to the managed cares,
Correct.
which one will? Thank you.
Janelle, if you want to continue on and answer that, go right ahead.
So there are multiple alternate EVV systems that can be used to send data to managed cares. Ultimately, each managed care has their own EVV solution for their aggregator. It would need to be a solution that could be certified, integrated, what have you, with that MCO's aggregator.
Thank you, Janelle.
And then one other part to that question, I started backwards. When are we going to expect the names of the 8 home healthcare patients to appear in the SANdata free portal?
So if you're using if you're using the free SANdata EVV system, again, that won't occur until August 10th when the program would go live. And that's actually a good call out here. And again, while this is not a free DHS EVV related call, those agencies probably will want to look for the training emails. You may want to take some retraining because there's going to be some new features that go along with that. So again, that's not an alt EVV related topic, but for those people that are using this free DHS system and that are still on the call, you may want to look out for the training notices so that you can take the training for those system users.
Well, in the sake of time, we'll keep going on here. We'll try to get to some of these other ones at the end.
Okay. And again, just to kind of reiterate, an employee identifier does have to be one of the 3 formats that we're displaying right now on the screen. So you will need to have either a unique registry ID or use that vendor specific employee identifier value, which is the preferred path. And again, you'll have a 2-character vendor specific prefix. If you don't have a vendor specific prefix that's listed in our appendix, please contact SANdata so that we can add your vendor as a valid prefix to make sure that we can take your employee. With the addition of the employee identifier from the vendor system. So whatever that vendor system identifier for the employee is. Again, the last 5 digits of the social security number is discouraged. This is something that has a higher occurrence of duplicate caregiver rejections, and we would prefer that that not be used, understanding that in some of the provider accounts, that is an existing employee identifier. Thanks so much. Let's go ahead and move
Chloe,
on.
I'm going to interrupt you just for a moment, just to remind people that may have notify people that arrived late. When you're asking questions, if you could help us out and add the slide number to your question. So if we don't get to your question right away, we know what slide you're referring to, please. So again, just remember to put the slide number in to help us out when we're answering your questions. Thank you.
Awesome, thanks.
Thank
So visit overview, the third transmission that we will be looking for from the alternate EVV vendors on behalf of their provider agencies are the visit data. This is going to have one required segment, that's the visit general. So every time that a visit transmission happens, we will expect a visit general segment to come through with that. There are 3 conditional call segments. You'll notice I said conditional and not optional and not recommended, not required. It means that depending on what information you're sending through for that visit, you will send these segments as required in order to make sure that that's updated. So as you're sending your call data, your call in or your call out, or both of those information, you'll send those child segments through, and they would be required again for that visit transmission to have that call data. Visit exceptions acknowledgement would only be sent when you are acknowledging an exception that cannot be fixed in the system. Visit changes is a segment that will come through anytime that we have changes to that visit record. The identifiers that are used for this matching logic are the provider ID values. Again, we've gone through this a couple times, whether it's the national provider ID or the Medicaid provider ID. You'll use that based on the services that are being provided in that visit. Visit other ID values. These are an ID value from the vendor system. This value must be the same every time that you resubmit that visit with changes so that we are updating the same visit record. Otherwise, it will be considered a new record and it will cause a new visit to be logged in the system. You must use a client identifier that is already a client record in the provider agency. So again, that first transmission that we looked at for the client, this 10-digit identifier needs to correlate to one of those client records, and that client record must be successfully in our system before you send that visit information. The employee identifier, again, will be consistent with what was passed as part of that employee general transmission. And we want to make sure that those 2 values align, and we do have that employee record resident in the provider agency's records before you send this visit transmission. Great, let's go ahead and move on. There's one new required field for the call segment. It is a visit location type. And this specifies where that service was rendered to the recipient by the caregiver. It does have 2 values. One is home and one is community. So that is a new field, a new element that will be required starting in August. Required for all call types, including mobile, telephony, FVV, and manual, is this particular element as we have shown right below there. And you'll notice that again, those expected values are 1 for home, 2 for community. We do have a group code field for all visit segments, and it's up to 6 character identifier. The purpose of this particular field is to make sure that if we have one caregiver providing services to multiple clients, or one client who is receiving care from multiple caregivers, that we're able to link those visits together. This is done so that we have accurate reporting for the Pennsylvania team. This is also done so that our system would be able to use those visits in combination as necessary for the service code. All right, let's go ahead and move on. The procedure code validation. So the payer ID, the payer program, the procedure code, and modifier must match a set of combinations that are resident in our specification. In our appendix that we've talked about, it will list all those valid combinations of payer program, procedure code, and modifier. So definitely use that reference to make sure that you have a valid combination. The client identifier, again, as we talked about just a couple minutes ago, must be an existing client record in that PA-DHS EVV member feed and be loaded to the agency's account in order for that visit transmission to be successful. The employee identifier must match to an existing employee record that was previously submitted and part of the agency's account before that visit is received. Optional segments, again, are required based on the condition for the segment. So if there's any changes to a visit that you've already submitted, you need to make sure that that visit change segment is part of your visit transmission. Let's go ahead and move on. So call segments, there are some data elements for the cures that we just kind of want to make sure that you understand some new ways of using these particular elements. Other, which has been an existing call type and call assignment in the program, is no longer a valid call type. Call types that are allowed are mobile, telephony, FVV, and manual. I know Paul did a great job of running through these in the beginning, but I'm going to just kind of really quickly touch on those again. Mobile is any call or visit, call in and call out time that is recorded using a handheld telephone or tablet device, so some sort of mobile application. Telephony is going to be a call type that's associated with any IVR or telephonic, call in, call out mechanism. FVV, that fixed visit verification, that is a device that records date and time that would be used by your EVV vendor to be able to validate that electronic visit verification. And it's located in the client's home in most cases. And then for that manual visit type, that is going to basically be that bucket for everything else. If there's a manual call in or call out because of a problem with the technology, if there's some other reason that there needs to be a manual adjustment, if there's some other type of call that's created that doesn't fit one of those other three categories, manual is going to be that call type. The only valid call assignments are going to be time in and time out. Those are the only reasons that we should have an assignment to that call. Other is no longer applicable. For FVV, those call segments are going to be required to have latitude and longitude fields associated. So again, if your fixed visit verification is happening at that recipient's home, that latitude and longitude should be populated with the home address, latitude and longitude, so that that is something that is recorded as part of that FVV visit transmission. All right, and then we are going to follow some existing logic. Mobile has always required that latitude and longitude field, and so that is continuing to be the case as we move into our home health phase. For telephony, we still also require the originating phone number and telephony pins. So based on whether you're doing FVV, mobile, or telephony, again, some of those fields that may be conditional become required based on the type of call that's being made. I'm going to go ahead and take a break here for just a moment and answer any additional questions that we would like to have answered.
Sure. For slide 22, we had a question on to clarify when the PA unique registry ID needs to be used. It was mentioned that the vendor specific employee identifier is preferred, but it said that the registry ID may be required.
Correct. Registry ID is required for the OLTL, participant directed care. So certainly if you are working within that program, that will be the employee identifier that's required. And all of those should have that registry ID. And by all means, if your employee has a registry ID, please send that. Again, preferred as in preferred over the social security number as an option is why we have that second one. And in most cases, that vendor association with a local employee identifier for the provider agencies gives us the uniqueness we need to be able to identify that employee.
And next one is, could you confirm that exception codes are only required when changes are made to visit data?
So exception codes are only required when you are clearing an exception. So you don't need an exception code or an exception acknowledgement segment if you're not acknowledging an exception. You will need a visit changes segment, which does have a reason code associated as part of any changes that are done to that visit after that initial transmission. So again, slightly different. Exceptions are something's missing. We're missing a call out, we're missing a call in, we've got something else and we're looking to send that acknowledgement segment in association with it. Versus visit changes require a reason for why a change was made to the visit, but not that exception acknowledgement segment.
And then kind of a follow-up to that one, or in addition to that one, can an exception acknowledgement be sent preemptively along with the original visit data?
Let me take that question back. I want to make sure that our answer is aligned with the program as well as our technical solution, and we'll get that answered separately.
Okay, and then one last quick one, good clarifier here, I think. Visit location type, which value is required, 1 or 2, or home or community?
It's 1 or 2, and those equate to that home or community. Great. Let's go ahead and move on to the next slide. So some new validation post HHCS implementation. So the EVV vendors are expected to have all these system changes to adhere to those technical specifications as of August 10th, 2022. I know we've really stressed that date. There are error messages for the following validations that will be implemented in the next releases that come through. So you will start seeing rejections for that other call type and call assignment that we just went through. Again, the expectation is that you've coded and that you've recertified and that you're not sending that call type and call assignment, but you will start getting actual rejections once we start having that validation in place. Rejections for missing call latitude and or call longitude fields for those FVV call types. Again, something that may come a little bit post that 8/10 date, but the expectation is that as part of your recertification, that will be part of the checklist and that you're sending that data consistently for FVV call types. And again, the rejection for the missing visit location type of home or community. You are expected to have that in place and being sent through as part of your certification checklist, and on that August 10th, 2022 date, but you will start seeing rejections as soon as that validation is in place. So vendors who have not adopted system changes will receive those system errors and they will get those visit rejections, and we just want to make sure that's very clear. Great, let's go ahead and move on. Services and modifiers. So this is a sample of the list that we have, and you'll notice that we talked about those payer programs, services, modifiers that are in this particular table. So they do say at the top of those tables which ones are going to be use Mary PI and which ones are use Nancy PI. And so we've got that really lined out as clearly as we possibly can to make sure that it's clear which provider identifier we are expecting to see in relation to that. So please refer back to those technical specifications. They are available on the PADHS alternate EVV web page. We can't stress that enough. Appendix 9.1.1 will be your friend. You definitely want to make sure that you are aligned to those specific combinations and following the directions that are provided related to your provider identifiers. Next. Visit exceptions. So we talked about visit exceptions. And again, there's really a very small amount of visits that would need to have acknowledgements sent. So in the program, visit exceptions really help us to make sure that the data aligns. It makes sure that that data has good validation. We target our cures, so unknown client, unknown employee, visits without in-calls, visits without out-calls, and missing service. Some of these exceptions will actually cause us not to be able to accept a visit at the front end. Again, we talked about how we need that client record to be in the provider agency. We will reject visits if that unknown client is being submitted on the visit itself. Same thing for unknown employee. If we can't validate the employee that's being provided in the visit as part of the employee records in the account, we will reject the visit. Missing service. Service is required so that we can make sure that we have this in the proper program and that it is a valid service for the program. And so therefore, as that visit transmission is being validated, if there is a missing service or an incorrect service that doesn't agree with our appendix that's in our specification, we will be rejecting that visit kind of at the front door. We will accept a visit without an in-call and without an out-call. Again, those are required segments to make sure that you have a visit that's going to be in a verified state. We have to know what that in time was and what that out time was, but we will not reject a visit just because it is missing one or one of those segments. So on that, you're going to see that you might have an exception within the aggregator itself. The only way to clear that exception is not through an acknowledgement. You will need to resubmit that visit with that missing data of the call in or call out date and time. So unmatched client ID phone. At times, we do have to use a phone number that's not associated with that client. This is the only exception that would require the acknowledgement segment for visits. In that case, you would send that visit exception acknowledgement segment. And again, I will get that clarification if that can come through at the time that the initial visit is submitted, or if that's expected to come through as a secondary update to the visit record. Awesome. I believe that gets through all of that information, and we're going to move on to the common support issues, but I'll take a break here just in case there's anything else that anyone wants to have answered on the previous sections.
Just a quick Claire, it looks like slide 22 on the employee identifier, I believe that was on. Are you saying there's only one of these 3 bullets is required for employee data transmission?
Correct. There's only one employee. We're talking about employee, right?
Yes.
So for employees, you only want one identifier, right? So only one of those are going to be used. So it will be either that registry ID or the vendor specific employee identifier value or that last 5 digits of the social security number. And again, I would say only use that if it's what you currently identify your employees as.
And then next question would be, do we need to recertify for every SANdata account we submit for, or just once for each alt EVV system?
So we will only recertify for the vendor one time, and all of those linked provider agency accounts will be considered to be certified.
And one other question, what if a client goes back and forth between community and home during the visit? Oh, looks like Janelle might be picking this one up.
So the visit location type as part of the visit information, I believe, let me double check on that. I think that's in the call segment. So I believe that it can change from home to community if there's a change in location from when the call in occurs to when the call out occurs. But let me make sure of that, and we'll get that fulsome answer back to the entire group. I think that's a great question.
Okay. And one other question, how do we go for retraining? Are you going to send us a link?
I believe
that's a
DHS
EVV question. So
Okay.
Again, this is because this is focused on alternate EVV. We'll answer your question, Renata, offline, okay?
Awesome. Thanks, Paul.
Thank you. No problem. So common support issues.
All right, let's head into common support issues. So if you do receive an error message, a request contains the following providers that are not authorized for the given account and credentials with that provider ID. That does mean that you have some invalid credentials. Please reach out to the SAN Data support team, alternate EVV support team, and we will work with you to get those credentials provided. Next slide. Client not found. This is error code 1021 on the client record transmission. So if you have a client not found error message, that client doesn't exist in the agency account. That could be because the client record JSON failed to be created properly. It could be because the transmission of the visit data has an incorrect client identifier. Or perhaps that client record hasn't been successfully added to the provider agency account. We do recommend that you go into the aggregator, make sure that the PEA DHS member feed with that particular client record has been matched, and that that client record is successfully added to the provider agency account. Check those technical specifications, make sure that you have formatted that client identifier properly and that it's in the correct field, and then ensure that that visit client identifier does match the client identifier that was submitted on the client record. Let's go ahead and move on. For worker not found, error code 1031, which again is going to give you that error message of worker not found. That employee is not properly specified. So either the employee identifier is not correctly formatted and therefore the employee record itself was failed. Either that lookup for it or just to successfully load to the provider account, as we're looking for each of those three formats to be adhered to exactly. Improper transmission format where a valid employee identifier is in the wrong JSON field. So sometimes we do see that, you know, something happens and we have an employee identifier that's not properly being transmitted. So check that PA DHS EVV aggregator. Again, providers should be checking the aggregator to make sure that their visit data is accurate and their client and employee records are also accurate. That employee record should show as being successfully added to the provider agency account. Make sure that those technical specifications for the format are being followed and we have a value that is in the correct field. And if you're still having issues with being able to get your employee record or, you know, the worker not found, even though the employee does show to be in the account, definitely involve our PA Alt EVV support team for additional troubleshooting. And if you do find that you've made some issue, you know, or found some problems in the format or with it being in an incorrect field, just do that visit maintenance to correct that employee identifier in the home EVV system and resubmit that visit so that it has the proper information. Let's go ahead and move on. So service ID error code 553. This is an error during retrieving service ID entered. There's a couple different things here, so we're going to walk through root cause 1, which is a missing service in the visit. All visits must include the service provided to the member in order for it to be verified. We do have in that alternate EVV technical specification all the valid service and applicable modifier field combinations to make sure that we have that correctly formatted value. Missing service in the case where we have a service that is not a correct service for the program, set of modifiers that are inappropriate, or a base HCPCS service code that is not included in that appendix do look like this and will return the same error. If you're finding that you're still having issues, that may require some SAN data investigation of that service code and the visit processing. So please, you know, alert our Alt EVV support teams and we'll take a look into that. If it looks like it should be correct and it's not coming through, definitely we're here to support you. Visit maintenance may need to be done in order to correct or add that service code in the home EVV system and then retransmitted by the EVV vendor. Let's go ahead and move on to the next slide. So same issue, service ID, error code 553, error during retrieving service ID entered. So in this case, we can have an incorrectly formatted service. So you know what the services are, they're in Appendix 9.1.1. It looks like it's a valid combination. What could be going wrong? All the services and modifiers are case sensitive and must use capital letters. So it does make a difference if we've got modifiers that are in a different combination. They are ordered. So W7060U4U1 is the valid service combination, but you will get a rejection for W7060U1U4. So please refer to that guide. Please use the order that's specified. Please use capital letters. If you do find that you have, made that kind of an issue with, submitting that information, visit maintenance in that EVV vendor may be required. Or if it looks like you have a valid combination with all the right capitalization, please contact us if you're still having issues being able to get that service code and visit to process. Right, next. So we've hit on this a couple of different times, but just to really drive it home, send those client and member records first. Send all your clients as soon as possible, even if you haven't provided a visit. Query that status on the transmission to ensure that you have all the clients loaded successfully. So you will get a response back that says that you have succeeded. If it's able to read the JSON transmission itself, all of those validation to make sure that we have proper formats, that we have all the required segments, that will require a secondary query to be able to get that status, make sure that that client is loaded successfully to the account. Send employee record second. We want all those caregivers again as soon as possible. So if you've hired a caregiver, send that record through. We're going to query that status as well, same way that we did with the clients to make sure that it's loaded successfully. Again, you will get a response back that you have succeeded if we are able to consume the JSON transmission that you've provided. That actual status of the record processing is something that is queried separately. Send your visits once you have validated that clients and employees have loaded. This really increases the chance of success on those visits and not getting an inappropriate rejection. Continue to send your visits on your defined schedule. Again, we ask for those to be sent through as quickly as possible. It is something that can happen real time, multiple times a day, daily. Those are kind of the preferred, expected schedules. Send new clients as they are created or an existing record is updated, and send new employees as they are created or an existing record as soon as it's updated. All right, and let's go ahead and move on. Great, we are here. So any additional questions that have come up that would be useful for us to answer for the group?
To get one more about exceptions here, or do we need to select an exception after we get an error from the aggregator?
So you've transmitted your visit, let's say, and it's been rejected. You do not need to send through an acknowledgement for exceptions. There's no exception at that point in time. That visit needs to have whatever that error was that caused the rejection of the visit in order for that to be properly entered into the system. Exceptions are only calculated on a visit that has been accepted into the EVV aggregator. Those exceptions can be viewed through the aggregator by the provider agency. They do have the ability to do a visit review and look for any of those issues. The visit exceptions acknowledgement, again, I'll double check to make sure. If you know up front that you've got unmatched client ID phone, we'll get you the information back on when is appropriate to send through that visit acknowledgement. Beyond that particular exception, no other exception should require a visit exception acknowledgement segment. All the rest of them should go ahead and only have a visit changes with any changes that are needed in that visit. All right, thanks, Paul, but I think you've gone a little bit further.
He had, the slide number was 23 in the question, so I wanted to get
Got
back
it.
to that question.
Got it.
Then we had another question. What would happen if the same visit data is sent multiple times?
So the same visit data can be sent multiple times, and that visit record will be updated each time that it is received. We would prefer that you not send visit data multiple times unless there is a change to the visit data. Once you have submitted it once and it's been accepted, if there are no changes to that visit, please do not resubmit that visit.
I want to add to that response. In the event that a vendor provider sends the exact same visit, a duplicate, into the DHS EVV aggregator, and it's not reflected as an update properly per the text specs, it doesn't reflect that it was a change and it's using the exact same visit key. What could happen is at the time of claims or encounter processing in the MMIS solution, the system will not be able to determine which visit is supposed to be used as the correct record, and it could result in our inability to find the appropriate matching visit to support that claim. So it's really important, again, as Clella indicated, to not send duplicate visits. If you're doing a corrective visit, there's a proper way to do that. And in that case, yeah, you can send an updated record, but we cannot receive and we should not be getting duplicates. If you do, it could cause problems during claims and encounter processing.
Perfect, thank you so much. And that is referring to the fact that visit other ID must be reused every time that you do a visit transmission for the same visit. Please make sure that's consistent every time that individual visit is submitted. Excellent.
And maybe just some clarification when about adjusted in and out times and the visit changes segment being required in those cases. Clella.
So if you have a change to the visit and there are adjustments to the in or out time, you will send those through in an update to the visit or in the initial transmission, and you should have a visit changes segment also provided with a reason for why there are adjusted times noted. Does that get that answer, Michael?
I believe so. I think we helped clarify there. And another question, I'm not sure. Will we still have a 15-minute window for clock in and clock and out times?
I'm sorry, say that again.
Yeah, I'm not. Can the person who wrote that clarify that question? Angelina, if you're still on the call, I don't know if you heard. If you can clarify that, that would be helpful, please. Mike, I want to ask one as well too on if the employee has been uploaded to the EVV aggregator before using the Social Security number identifier, can the vendor update their record with the new type of identifier? So can we discuss how, again, just really briefly, how they can update those visit record or those employee identifier records?
I believe you can go ahead and submit that record with that new identifier. So they will show up as having two different records within that particular provider agency, but you will use that new vendor or that new employee identifier from that point forward, and all of those visits will be linked to that new employee identifier and that employee record that represents that.
Yep, and you would use the old one for any
Changes.
legacy updates or any legacy visits
Mhm.
that were sent in prior to that
Mhm.
change.
All right. So what should we do if we're unable to update the current visit due to payroll already being processed? Can we have access to click the omit? Well, so again, aggregator is only read only. So you would have to send that in as a omission. So bill visit, I'm sorry, it's, I don't want to mislead you. Bill visit true, or I'm sorry, bill visit false, correct? Mike, you help me on that one.
You know what I would say, Paul, if you don't mind me jumping in, is
Absolutely,
that's something you probably want to work with your EVV vendor on, the correct way for you to be able to resolve that situation. So I would say that that definitely sounds like something where your native EVV vendor should work with you on the best way to do that. And if your vendor has any questions about how they can interact with the system, we're happy to, work with them on that as well.
Carla, we had a question come up in the chat or in the Q&A that I'm curious about the answer to myself. If employees have been uploaded in the EVV aggregator before with their social security number, last 5 digit, and the provider would like to adopt submitting the second format of the vendor specific employee identifier value, is that something that can be supported?
Absolutely. So what that will look like is there will be 2 records in the provider agency with the 2 different identifiers. So we'll create a new record with that new employee identifier. It's not a problem moving forward. As you are creating new visits, you will use the new employee identifier as how it is that you submit all that information. Probably the hardest part is that you would need to make sure that you use the old identifier if you're updating visits prior to switching that employee identifier. So, one little complication to it, but we're happy to take the newer employee identifier that has much higher certainty that your employees will not have any duplicates or updates inappropriately to the wrong employee record. Please let me know if that's, getting a little too in the weeds, and we can certainly get some support folks to help as well.
So we have a couple more questions we'll address versus answer, and then I think we'll probably wrap up the call here today. The one on the rounding rules, that we'll have to take that back to the specific program office to answer your question. Thank you for the clarity on that, but that would we'll take that over to the program office. And then we've got one question on why they cannot use the NPI versus Mary PI as the employee identifier. I'm not sure if I'm understanding the question correctly, but my concern there would be that you would be having multiple duplicate employees if you use that NPI number for each one of those employees. All right, well, that concludes the end of our presentation in the town hall. As a reminder for everyone that attended the call, we will be addressing questions that may not have been addressed directly on the call afterwards. Sometime next week, we'll be reaching out, or someone from the program office or SanData or DHS will reach out, or it may be posted on the FAQ site. So again, just be alert that there could be different modalities that the question is answered, as well as the posting of the presentation and the presentation recording will be placed on the Pennsylvania EVV website in the public meetings section of the PADHS EVV website. And again, I want to thank everyone for their time and wish everyone a happy long weekend and holiday. Thank you again, everyone.